OC World is made possible by the generous contributions of the Marisla Foundation, the Keith and Judy Swain Family Foundation, Orange County Community Foundation, the Cordoba Corporation, and viewers like you. Thank you. Hello and welcome to OC World. I'm your host, June Kim Lopez. CalOptima Health is the largest Medi-Cal health insurer in Orange County, serving nearly 1 million low-income children, adult seniors, and those with disabilities. Formed in the early 90s, the Board of Supervisors sought to provide a community-based approach to healthcare. The $4 billion agency has gone through some scrutiny, new leadership, and now is poised to enhance its service to the most vulnerable population in the county. To share their vision in our two-part series are Clay Corwin, Chair of the CalOptima Health Board of Directors, Michael Hun, their CEO, and Kelly Bruno Nelson, the Executive Director of Medi-Cal CalAIM. Thank you for joining us today.
Thank you, June.
All right, so we'll start with you, Michael, as the CEO. For our viewers who are not very familiar with CalOptima, how would you describe it briefly for our viewers?
So first of all, we really appreciate you being here and highlighting this. CalOptima Health has been here in Orange County as the Medi-Cal health insurance provider since 1994. So back in 1994, the city or the county had to make a decision whether or not they were going to build public hospitals or create what we are, and that's a county organized health system. And so we don't have any public hospitals in Orange County, but we contract for all the healthcare services for our members across the county. We have about 10,000 contracts. We contract with doctors, specialists, hospitals, skilled nursing facilities, pharmacies, long-term care facilities, also known as skilled nursing facilities. And so we are not a part of the county, but we are a separate public agency. So all of our funds come from the state and from the federal government. So 90% of our $4 billion budget comes from the state of California. It's tax dollars. And about 10% come from CMS Medicare for our Medicare recipients. That makes up our $4 billion. And so the county said, let's create this agency. Let's set it up. It has a 9-member fiduciary board, so we have a board of directors led by Clay Corwin right now. And they set our policy, they set our budget, and they oversee all the services that we provide. We're an insurance company just like Blue Cross, Blue Shield, Aetna, Cigna, HealthNet, and we're responsible for the health insurance of about 1 million people here in Orange County. The population is about 3.1 million. So right now we insure about 1/3 of the entire county of Orange. And all of the folks that we insure qualify because they are low income. So for a family of 4, it's typically making less than $40,000 a year. Combined. And for an individual, a little less than $20,000 a year. And if you qualify and are given the health insurance card, you can then access the network of providers that we contract with throughout the entire county. If you're a CalOptima Health member and you're in the Medi-Cal program, not only here in Orange County but anywhere in the state, there is no premium, there is no copay. It's fully funded by the state and the federal government. Those funds come to us. We contract with the hospitals, the doctors, and the other providers, the pharmacies, the skilled nursing facilities. We in turn then reimburse them for those services, and our members receive that care. Our mission is pretty straightforward. Our mission is to make sure that there is good access, that there's good quality, and that people are treated respectfully and with dignity. And we serve a very diverse population here. Out of our almost 1 million members, English, Spanish, Vietnamese, Korean, Arabic, Chinese. We cover a lot in this community, so it's pretty impressive.
So as the chair of the board, why do you think back in the 90s, the Board of Supervisors decided to take this route for Orange County in healthcare?
Well, I don't have the history on it, but I would imagine they made a deliberate decision that the existing infrastructure that was in place in the county, the providers that Michael has mentioned, were already there, and it was a better utilization of resources than going out and building new, hundreds of millions of dollars of capital in hospitals.
And your background is in commercial real estate investment, correct? So from a business perspective, a lot of times anything that's formed by the government, people are a little skeptical about, is it better than the private sector, which, as you said, it's unique to Orange County, the way that we're providing Medi-Cal service through CalOptima. Do you think that it's a better way to provide this critical service to the population of Orange County?
Well, I do, and I do largely based upon what I've seen as well as some of the changes that we've been able to implement over the last couple of years by bringing in new leadership led by Michael, bringing in somebody of Kelly's caliber who's uniquely qualified to lead the CalAIM initiative and all the important pieces of that to our community and to health in the community in general. So yes, I do think it's a better model, and I think we're proving it so.
There's a lot of questions that I have, but I do want to step back a little bit because not everybody understands there's Medicare, Medicaid, Medi-Cal, and all the counties function somewhat differently. This is a national program funded by the government. So for our viewers, Kelly, can you sort of explain briefly the difference between Medicare, Medicaid, Medi-Cal, and how that's provided in state of California and what makes Orange County unique?
Certainly. So Medicaid is, for all intents and purposes, the same thing as Medi-Cal. We just in California like to call it Medi-Cal for California. So that is for individuals, as Michael mentioned, that are under a certain socioeconomic level, make a certain amount of money, and it's an entitlement. And it provides all the medical care that you and I would get from our commercial insurance programs like Michael mentioned. So Medicare and Medicaid are national programs, and we support both of those, or we're involved in both of those, but Medi-Cal is just specific for California.
And you are the executive director of Medi-Cal, CalAIM.
Correct.
And AIM stands for California Advancing and Innovating Medi-Cal. There's a lot of acronyms in your world. So what is the purpose of your role under CalOptima? Because you work for CalOptima, but you are in this position of improving Medi-Cal. How do you do that?
Sure. So California in the beginning of 2022 really set the stage for the entire country by starting an initiative called CalAIM, Advancing and Innovating Medi-Cal. And that is California's recognition that a person's ability to be healthy is determined primarily for factors outside of the hospital or the doctor's office. When we think of medical or care or medical care, we think of going to the hospital or going to the doctor. But the reality is that's only a small percentage of what determines our ability to be healthy. Our ability to be healthy is more so determined by social factors outside of the hospital. Housing, transportation, our ability to access fresh fruits and vegetables and fresh water, getting a good job, living in a neighborhood that's safe. These are things that have a larger impact on our ability to be healthy. So California has recognized that, and in doing so has launched CalAIM. CalAIM is that initiative, and it makes social service benefits directed specifically towards those social determinants that I just spoke of. So now housing is a benefit of Medi-Cal. The ability to find housing we pay for. Medically tailored meals in order to help somebody be healthy is now a benefit of Medi-Cal. Those are just two examples, but that's what CalAIM is. So my job here is to operationalize that in the county and build the infrastructure necessary to provide those services to our members.
So you talked about, Clay, that this is working better. This is a better model that we're doing in Orange County. How do you know it's better? What kind of measures or metrics do you look at to say it's functioning better in this mode?
Well, I think we're seeing from a business side, I'll start with that, a much more efficient operation going forward. From a budgetary standpoint, and one of our main charges obviously is to manage this program in a fiscally responsible manner, is that we spend over 93 cents of every dollar on health care. Goes directly for the benefit of our members and for our providers who are administering to those patients. So our overhead costs, which people always look at and see numbers at, are under 5%. So right there fiscally, and we're doing things better than a lot of other health plans in California as well as across the nation from a efficiency and utilization of dollar for the ultimate benefit of our mission.
And as the board, are you assessing that annually? How do you actually do that? Is there another organization that provides an oversight above the board of directors, or the board of directors look at these metrics and see how well you're doing as an organization?
So we look at those metrics at least monthly. We have a very robust financial reporting, accounting, audit, and compliance system. And so those are reviewed, part of our board package, every month that we meet. We additionally have a finance and audit subcommittee that meets quarterly to get down more into the weeds, to ask questions, to work with staff on a budget going forward into the next year. So we have total visibility and transparency over all those numbers, as does the public. All this information is published and easily accessible on our website, so anybody can see what we're doing. They can come to our public meetings, they can show up online. So there's the information out there. How do we know that we're doing better? We measure it. We measure it against what has been done in the past, what our expectations and budgets are going forward. Starting with Michael's advent here a couple of years ago, we have gone to basically a balanced budget or a zero budget approach, which makes sure that we're not overspending things, that we're not using money wastefully to try to balance a budget from a deficit perspective. So there's that discipline, which I believe is important and should be important to everybody. In terms of utilization with members and results, we do customer surveys, we do member surveys, we talk to providers. The amount of engagement that Michael and his staff has brought to the table of reaching out to every provider, asking, what can we do better? How can we be better with you? Everything we do is a partnership. Every provider we deal with, because they're providing services to our members. You can almost think of us, even though we're an insurer, as a platform, right? We're connecting nearly 1 million members, a third of this county, with over 10,000 providers, and making sure that these people are getting what they need from these people in a timely, accessible, and quality manner. And in turn, that our providers are getting the tools that they need from us. Certainly a lot of that is payment, timely payment, but whatever support, and certainly a sounding board, so that if we're doing something that's not best for our members or our providers, that they have an opportunity to tell us. And that kind of two-way communication and partnership is something that I think has become much more robust here in a changed culture in the last couple of years.
So do a lot of people respond to these surveys?
We get good response. We have responses back from our medical groups. Every single month they're required to give us updates. So we have tremendous data and information. And then we do direct outreach to our members. Most of the time we get a little bit under 50% response in a population of 1 million. That's a very good number for response rates. And so we get a good feedback. We have a customer service center here. We have about 230 staff. We field about 60,000 phone calls a month. And we have also a department called Grievances and Appeals. So if you call up and you're not happy about something, that's a grievance. If you have a denial for a service, that's an appeal. So if you call up and say, I don't like the color of my insurance card, I don't like the way it's printed, and it came in a wrinkled envelope, that's a grievance. I didn't get to see my doctor as fast as I want to, that's a grievance. And so we track all of our grievances and appeals to make sure that we're responding to the needs of the members. And given the fact that we get 60,000 phone calls a month, there's a lot of interaction and communication. We also work collaboratively in the county with the Social Service Agency. The Social Service Agency is a department of the county and is funded through the county with dollars that they receive from the state. they're the ones that actually fill out the paperwork for an individual to become eligible for Medi-Cal. So it's interesting. Another agency does the sign up, but we administer the health insurance.
So let me back up there. If I move into Orange County and I meet the eligibility threshold for Medi-Cal, am I automatically signed? How does one get on this program? I don't know the area. I don't know how it works in Orange County. I just know I don't make a lot of money. I need health care. I'm not feeling well. Kind of walk me through the step-by-step of what I would do.
So pretty straightforward. If you're moving in, you're now in the county, you're now eligible, let's say you meet those thresholds for low income, you can call directly to the social service agency at the County of Orange, and you can apply over the phone, or they will send you a link to benefitscal.org, and you can go to the Benefits Cal website for the state of California, and you can apply online. You fill out all the information, you upload some payroll and payment information to verify income. The state then will take that application and they either approve or disapprove that application.
Why would they disapprove if I meet that eligibility?
If you meet eligibility, obviously if you're approved, but if for some reason the numbers don't match out or the information they receive is unverifiable, they may deny it, and then you can appeal that. But you go through the social service agency or you go through the state website, Benefit Cal, and you can go to the internet to do that. And then you will be notified that you've become eligible. It takes about 6 to 8 weeks for that eligibility process. Then the county social service agency informs us that you now have been approved. The state sends you the insurance card, and then we reach out to you and say, we'd like you to sign up for a provider, we'd like you to sign up for a medical group, no different than you do with any other health insurance, same process.
So then it takes about 6 to 8 weeks now that I have it, and I have to go to the emergency room. And then I give the card. Is it that easy and everything is taken care of? There's no issues or delays or rejection?
So if you have a medical need, and let's say you need to go to the emergency room, you can go to any emergency room anywhere in the County of Orange. You can go to the emergency room anywhere in the state of California. You can go to the emergency room anywhere in the United States. There are rules for emergency care that are governed by the federal government. And so you have access to emergency care no matter who you are, whether you have insurance or no insurance, whether you have Medi-Cal or don't have Medi-Cal, whether you have a commercial insurance or no commercial insurance. Anyone and everyone is entitled to go in an emergency room and receive care. If it happens to be a CalOptima Health member now, and you go to an emergency room here in Orange County, you will present your insurance card just like you do with any other insurance, and they will process the claim for that insurance visit, and that's all you need to do. There are no co-pays, there are no deductibles. If you're a Medi-Cal Health member, you're fully covered and you can receive those emergency care services, and we are our delegated groups that are responsible for that care will pay the emergency room for the care you received.
So it sounds like, Kelly, from what you shared with CalAIM, you're looking to expand the current offerings under CalOptima Medi-Cal service. And how does a member of the public know about all these changes and expansion of programs? Because, going on your website, there's a lot of good information there, but if you don't know to go to it and you don't really understand what CalAIM does or the different services provided, how do you explain it to the public?
That's a great question. So there's really two strategies to be able to get the word out. One is more traditional, where we have media campaigns that are, all over the county, flyers, information on our website, as you just mentioned. That's the more traditional way, and of course that works. The other way that CalOptima Health, I think, is doing this a little bit differently is we're really investing in the community. We need to go where our members are. So instead of just contracting or having a few partners, as Michael mentioned, we have hundreds of partners, and so we want to continue to expand that. So from the CalAIM perspective, when it comes to our unhoused members, for example, instead of just having 1 or 2 contracts with providers, we have over 75. So the way we find our members is where they go. So we can invest in the community, contract with all the providers that are helping our members, and then reach our members that way.
So with so much things that are happening under CalOptima, you have about, 1,500 employees in your organization. That's a lot to oversee as a board member, and obviously the responsibility is on you and the other board members. So can you talk a little bit about the governance structure of CalOptima? How does one become a board member of this $4 billion agency?
Sure. The board of CalOptima is comprised of 9 members plus an ex officio member, the head of the county healthcare agency. Those 9 board members represent all facets of our world, from members to hospitals, doctors, and other professionals, as well as the public. And those board members are selected through a process through the Board of Supervisors that ultimately makes those appointments. Those individuals have an array of experience, background, expertise, and interest, all of which creates for a better board in terms of dealing with the governance that you're talking about. In terms of oversight, that is part of our core responsibility. But part of managing an organization from a board perspective is first and foremost making sure that you have the right people in the right leadership positions on the organization for a day-to-day basis. These are the people like Michael and Kelly and all of their senior staff, as well as their entire team, that get the work done every single day, and it's a lot of work. And part of that goes to instilling a culture here that, again, is seeing market improvement in terms of why you work here, embracing the mission, and having the care, compassion, empathy, dignity, and respect for every individual that makes this a successful organization and starts to make sure that our members, as well as the community as a whole, understands what we're doing. So in short, one of our most important roles is making sure that people we have in leadership and management positions at the top are the best that we can find. And I believe we've gone a long way toward doing that.
So the Board of Supervisors of Orange County, they pick the board members. And how often do you change? Is it a lifetime you're on the board, or what's the term?
The terms are 4 years.
Okay. Are there term limits?
I'm not sure. That's a good question.
Yeah. But the Board of Supervisors select the 9 of you, and what is the process? What are they looking for when they're selecting you? Because, one would argue, and we hear this not just in your organization, but everywhere, it's about who you know more than what you know. So how do we ensure that really those who are providing the oversight have the background and the ability to be able to manage such a large organization and its people?
So the board goes through a recruitment process on that 4-year cycle, and from time to time there are vacancies because people have had to leave the board, they move out of the area, they have some other issue. So there are periodic appointments in that process. But they go through, again, a recruitment process, and they're looking for individuals that meet the particular criteria of each board position. So there needs to be a director that represents the members, because they or a family member happen to be a member of CalOptima. There's an individual who is designated to represent hospitals, individual designated to represent community clinics, and so on, and an individual to represent the public. There's a few other categories. So certainly they're going through an initial vetting process to make sure applicants meet the qualifying criteria for whichever board position they're filling. After that, every board goes through its own process in terms of how they vet those individuals and how they make recommendations as to who they think is the right fit to be a board member. And I imagine that those criteria change from time to time based upon how the Board of Supervisors looks at the organization, what they feel the needs are, and what the best person is for that window of time to advance those needs.
And a lot of people recently have been looking at CalOptima. What was your reaction as the chair when you heard about the state audit?
A couple of things. First, we always appreciate the chance for somebody else to take a look at how we're doing. Sometimes you don't see things, and we should always welcome an opportunity to get better at what we're doing. So the process, that's fine, welcomed. It covered nearly a 9-year period through June of 22. So it covered periods of time where none of us were around, but nevertheless, there's an organizational responsibility to address those concerns. In terms of the findings of the state auditor, really, I think we feel pretty good that there was nothing really that we felt was either a significant problem going forward or something that wasn't already being well addressed. I believe the key finding was a sense that we had too much surplus funds in reserves and that we should be getting those out into the community. Now that report, as I say, looked through as of June of 22. Since that time, we have approved funding of well over $500 million of new initiatives to meet all the various objectives and needs of our communities. So we feel pretty good that we're heading in the right path on that one already, and we're already looking forward to the coming year for additional allocations. I think the other key finding was around an employment practice versus policy scenario. So we've already taken steps to basically institutionalize into a policy what has been historical practice for years.
All right, well, we're going to get a lot more into the elements of the state audit, obviously get all of your reaction and sort of the path going forward in our next part. It's a 2-part series, so thank you for being with us today, and we'll talk more in our Part 2 series. And thank you to our viewers for joining us today. Join us next time for the Part 2 of this important conversation about CalOptima, the largest health insurer in Orange County. Until next time, stay safe and be well.